So I think one of the first things that we need to do is we understand at a country level, at a subnational level, what are the hotspots of leprosy. And at the same time, we have government data that shows us that the same districts which have high prevalence of leprosy are also equally vulnerable to climate extremes. And we also have the government data that shows that those same districts which have these two challenges of leprosy and climate change also face multi-dimensional poverty. So there is multiple and simultaneous deprivations in terms of food, education, housing, sanitation, and all of that. Now, when we have these data as a proof of concept, the Ministry of Health, the Ministry of Environment and Climate Change, not just at the national level, but at the subnational level, at a local level, need to talk to each other so that we are able to create the policies that are so that the climate and the health don't work in silos. Thankfully, in India, we have something called National Program on Climate Change and Human Health, and they are really trying to marry both the concepts together and think of a solution wherein we build the community resilience, not just looking at floods or drought or any other climate extremes in isolation, but already looking at the existing vulnerabilities of the person. So what we proposing is that let's do a district level vulnerability mapping of these people. It need not be only leprosy, but it could be any other vulnerable diseases, vulnerable population that are affected by those diseases. And let's find out the solutions.